Welcome to the Scully Sez podcast, talking all things law, business, and more. Now here's your host, Tom Scully.
Are you ready for today, Patrick?
Oh, yeah.
Well, we talked about a little bit about limited government, as far as limited government, and then the high prices of pharmaceutical drugs. So far, you with me?
Yep.
Okay. Well, I've always been in favor of kind of limited government. I always thought that the government should keep the mitts off our business as much as possible. But sometimes they can't stop themselves. And one way that they're able to do it, and which is not all that obvious, is by grants. They give grants to different people. So they'll give grants to, say, a school, or say a radio station, and they do that. And of course, if you don't adhere to their line of thinking, then they might just take the grant away. Do you see how that works?
Yeah.
Yeah. So you'll if you want that grant, you'll kind of toe the line, and so that's what they do. They you get grants, and when you give a grant to somebody, there's a certain amount of control that you exert over that person, and so it's hard to turn down money. You know what I mean?
Right.
Yeah.
I mean, well, it's like if it's the same thing as like if I ask the people at my pizza shop, the people who work for me, oh, do you think it's like better today, or do you think the food's good today? You think that's a good pizza? Like obviously they're gonna say, they can't give you a true opinion. They can't give you the true feelings on it because I've literally pay them, right? So it's like they're gonna try and do whatever they think makes me happy, and it's the same thing on a government level. The problem is that it doesn't seem like what makes the government happy really aligns very often with what makes the individual citizen happy.
That's true, but a lot of times the individual citizen doesn't really appreciate the fact that the media or what have you are controlled by these grants. They hear the information, but they don't know why they're getting that information. But the reason they're getting the information is because the person that's giving them the grant, or the people that are giving them the grant, basically are kind of influencing the way the information is given out. So that was one of the things.
That's a good point, actually. You say though, because yeah. So if you're given a grant by the government, and you have to give an objective review of how the government's doing on something, or even like if you are going to represent something as like a riot versus a protest versus any of those type of things, all those word choices, instead of becoming like objective like decisions to like get truth out, they become like political decisions. They become like if I say the wrong thing, like you said, you lose your money. And then if you lose your money, you don't have any airplay. And, it can be a really slippery slope where someone's like, well, I'm willing to take a little bit of the government oversight and government money and be softer on certain things because it's more important that I get my greater message out. But like, you do that for long enough, and then your greater message will, be perverted to whatever the people who, line your pockets essentially want you to say.
Yes, we call that little by little.
Yeah.
Yeah. And so I was just I think the entities that are most affected by these grants are schools. And when I say schools,
Mm-hmm.
I'm talking about the grammar schools, the high schools, and certainly the colleges for sure.
Mm-hmm.
And if you're not talking about the colleges, you're talking about hospitals, you're talking about medicine, you're talking about pharmaceutical. And if you're not talking about those, you're talking about the corporations, And certain corporations are favored, and they get multi-million-dollar grants, multi-billion-dollar grants. And so, if you're getting a grant and you're a corporation and the grant is big enough, if they cut that grant off, that may be the end of you as a corporation. So, of course, the more dependent you become on grant money, the more dependent you become on the message that's being given to you by the people giving you the grants. Yeah, you see that? Yeah.
Right.
Yeah.
Absolutely.
Yeah.
And it's the same. It's the kind of the way that almost everything I feel like gets done in the country, because it's the same thing with like automobiles or like the highways or something. Like the NHTSA has groups that lobby them or that lobby for them rather, and those groups are usually oftentimes funded by automotive industries, you know what I mean? And so like, whereas in like Chicago, for example, you have the Ventra system, you know what I mean, how it's like the privatized, even it's privatized public transit. It's not great, but it's the way that it is. Like when you have that, and then you have like the metro system, and you have all those other systems, those could very easily be working together, but they have like, there's like political like positions propped up to stop them from finding common ground, and you find that all over. Like it's been common in that type of reality, like, with lobbying and stuff like that for a long time. But like now you see it to the point where, you'll get your social media feed will be like, essentially bought and paid for in a certain way like that, in a certain manner of speaking like that.
Yeah. Well, when I was much younger, there was this guy, his name was Vance Packard, and he came out with this book. It was called The Hidden Persuaders. And what he was talking about was the advertising agency, where they'd come up with these different ads, and little by little, they would convert you over to a certain way of thinking. So that was with the advertising agency, but the hidden persuaders, there are a lot of hidden persuaders today. I think particularly when you think of lobbyists, those are the hidden persuaders.
Right.
And, whether they be right or whether they be left, you don't know who they are. You don't know where they're coming from, but they're there, and they've got a lot of money behind them. And so as a result, they're able to convince different people, particularly people in power, as to how they should conduct themselves or how they should vote, which kind of gets us to where we were kind of going in a slow direction, was the pharmaceutical industry. Yeah.
Sure. Yeah.
Yeah. And I think we were talking a little bit earlier about the pharmaceutical industry. I was just looking at some of these CEOs for the pharmaceutical industry. I think Eli Lilly's CEO is getting paid. I think it's $25 million a year. I think 25 million, but he's not alone.
Right.
I think they have the top 10 people, the top 10 CEOs for the pharmaceutical companies. They're all somewhere hovering around $20 million. I mean, they're doing as best they can on that limited budget, but they're scraping along. You see, and
well, that's, I mean, you saw people kind of wake up to that reality of, obviously we're going to talk about greater points within the pharmaceutical industry, but like even just on face value, when you look at that salary and then you look at the amount of problems people have getting drugs that they need, and you look at the amount of like clunkiness there is in like getting like care through like any sort of medical system, and it's not always the medical system's fault. It's a lot of times they point the blame back at pharmaceutical companies and stuff. That's why people were kind of championing that guy. What was it? How many 6 months ago? The United Healthcare guy.
Oh yeah,
That's why that happens, and it's macabre, but you see where that mentality can arise from.
Oh yeah, well, there's the free market system, and the idea is I've got something and you want that, and so you're willing to pay a certain amount of money for it, and but it's a little bit different in my mind with the pharmaceutical industry, because you're really not a free agent. What happens is you're sick, or you're infirm, or you're having, you're desperate, and you need these. You're not in a very strong position. You need these medications, and so a lot of times you're willing to pay an exorbitant amount to get these medications. And I believe that that's what some of these pharmaceutical companies are. They're actually they're dealing with. They're trying to foster that idea, and they're making money off people's misery.
Absolutely.
And, yeah. So
well, and that, I mentioned the United Healthcare, but that's the hand in hand problem, right? Is the insurance companies and the pharmaceutical companies. Like these are some of the biggest names, period, as far as corporations go, insurance companies and medical companies. And yet still, like, exactly like you said, it's the people who are there preying on, or even just their average customer, is someone who's like literally got their back against the wall, and sometimes maybe has no other choice. Like, when I'm doing research for what we're talking about with like insulin and stuff like that, like, most of the reason, not most of the reason, I would say like a good, maybe like 40% of the reason why insulin is so expensive is because there's only 3 companies that can make it.
Mm-hmm.
You know, and just simply put, I mean, like, trust me, it would make it like, even I can go back to just what I know, a pizza shop. Like, if you make it so that I'm the only pizza shop for a 200-mile radius, what does that do for my business? You know what I mean? Or make it so I'm one of 3, let alone the government and doctors and all those people working together via, whatever the money comes from. But, people are being paid to push your brand too. You know what I mean?
Well, one of the things that they do, particularly with insulin, these companies, what they do with that, they have what they patents. And the patents, what they'll do is they will change the patent just a little bit, and they'll increase the life of the patent, and they just keep on doing that. So something that came as a surprise to me was insulin has been around for 100 years. It's been around for 100 years. So, and we know in our own family, we have problems with paying for insulin. I mean, it just the cost is absolutely outrageous, and a lot of times people don't realize how expensive these drugs are, because very often it's being paid for by way of Medicare or by way of different government insurance policies.
Right.
But somebody's paying for that nonetheless, and it's usually somebody like the taxpayer. So you don't see that. It's not that obvious sometimes, but like with Medicare, with when you're buying insulin or you're buying these different products, what's happening is the cost that you're paying in terms of taxes or is going up, but you really don't know why it's going up. But the reason it's going up is because you're paying these exorbitant prices for these medications. Yeah.
Right. Well, and even further still, like, obviously my fiance is in the medical field, and so she sees people, she sees patients all day, and works in the hospital all day. And she says a lot of the times you'll have insurance company, insurance representatives or pharmaceutical representatives like intervene while care is supposed to be given, and they'll like alter the outcome of like a care plan, like based on like putting pressure by like, oh, they need this, or oh, they should have this, or oh, like she sees that on like a pretty regular basis. And it's wild to think that, even at that level, the amount of oversight these like massive corporations can have on the way that you receive care.
Yeah, so I think like when you're talking about the excessive fees that the CEOs are being paid, of course it goes down the line, and so everybody's getting a little bit fat on this. One of the other things which came to my mind was the fact that they have these people right now, which are they're people that come on. They're the middlemen, and the middlemen get paid quite a bit of money to set things up, I think. And there's a lot of there are a lot of programs underway trying to minimize these guys. But right now, the pharmacy's costs are rising. Within the last 10 years, some of these costs have gone up 3-4 times, and so that's part of the problems that we have. And one of the things that we mentioned, I think, with the pricing controls, it's kind of a slippery slope, because of course you want these people to be curtailed to a certain extent as to how much money they can possibly make. But then by the same token, you have a problem with the government getting involved and trying to control the amount that a person can charge for the medical or for the pharmaceutical goods, because you get to the point that after a while the government may be controlling the medical field. Do you follow where I'm coming from on that?
Yeah, exactly. Exactly. That's the problem is, do you either have to have that government oversight, or you have no government oversight, and you kind of get to wherever the like profit incentive based model gets you. You know what I mean? And like I'm definitely with you, like in theory, like the limited government is better. I just have a general distrust of like of maybe not even just the government, but just the organizations of people, where like a point can get diluted that much amongst that many people, and like what they're actually trying to accomplish kind of gets muddied because of so many different desires. Like that's the problem. Like I don't want a group like that where there's so many different vested interests coming in and having anything to do with patient care. You know what I mean? Like that the most important thing is the people who study for their lives to determine what is best for a patient. Like that's the person who should be making the judgments, and then the family of the patient or the patient themselves, and that's it. There doesn't need to be any other oversight. But like you said, they're also, it can't just endlessly go up and up and up and up and up in as far as cost to patient.
Well, sometimes what they do is things become more complicated. And the more complicated things become, or the more steps they put in there, the more expensive it becomes. I mean, I give you an example, which is kind of simplified example, but nonetheless, I can think that it says something. It used to be many years ago, you'd have the family doctor. He'd have this little black bag, and he would come to your house. He'd come to your house with this little black bag. He'd give you a shot or something. He said, that'll be $25, and he toddled off on his way. Well, the day of the little black bag, the day of the $25 and all that stuff, I mean, that's long gone. Yeah.
No.
So, but what was happening is it was simple and it was direct. So when he said to you, it's going to cost you $25, you'd have to put your hand into your pocket, and you'd have to come out with these with your dollar bills to pay it. So you know what you were paying for.
Right.
It was a direct payment. So what happened is, over the years, they came up with this idea of health insurance, which was, and don't you say, now you no longer have to put your hand into your pocket and come out with this $25. We're going to make it a lot easier. What we're going to do is every month, instead of doing that, we're just going to charge you $10 a month.
Right.
Oh, well, $10 a month, that's not bad. Well, times have changed. It's got a little bit more expensive now. It's $25 a month, but we can live with that. Do you see?
Well, that's everything's been trending that way, right? Like even like the idea of leasing a car, or the how much more prevalent renting is, or anything. Like everything's a subscription based model now. Like even like just anything you go into, you know what I mean? It is a subscription based model. It's pushing you towards that.
Yeah, because much more expensive as time goes on. You make it more expensive. You put more steps into it, and every step that you put into this process, every step gets paid.
Right.
So again, now you have these health insurance companies, Blue Cross, United, whatever the heck they are, and so you're not paying $25 a month anymore. You may be paying a couple $100 a month anymore if you're lucky. And those prices continue to go up. It reminds me of, do you remember when cable first came out?
I remember grandfather getting a TiVo.
Yeah, there you go. And so you have these, and here's the idea with the cable. You see, there's going to be you get rid of this antenna on your rooftop, and as a result, what's going to happen is you're going to get a much clearer picture. And it's going to be that much more convenient for you, and there'll be no advertisements, and it's going to be cheap. There'll be absolutely paid nothing out of it. Basically, it's a couple of bucks a month, and there you go. Well, what's happened with the cable. You know what's happened there, right? I mean,
right.
It's more than a couple of dollars a month now, As funny as it sounds, I mean, there have been some ads that have crept into the programs.
You'd
I mean,
find it hard to believe that they'd go back on that.
Oh yes. I was watching the other day, and I saw a program, and so we had 10 minutes of the program and 8 minutes of the commercial. So little by little, these things, and so the analogy, of course, is quite similar with the healthcare. Yeah, with the healthcare, with the prescription costs and so on. And so what used to be relatively inexpensive has climbed up to the point that you no longer have to pay directly. You see, it's indirect, but
right.
The payments are coming from multiple sources. So payments are coming from your pocket sometimes in form of deductible. They're coming in the form of insurance premiums. They're coming in the form of taxes, and so the prices continue to go up, and so that
it doesn't. The problem is there is no like end in sight for that, right? There is nothing that curbs that in like naturally, at least that we're aware of, because like even again, I can relate it back to like what I know, but like in my own business, like if there's incentive to gain profit, why would I leave it on the table? Now, like me personally, like I don't mind leaving a little bit of profit on the table to make things easier for my employees or for myself or whatever, you know what I mean? Like that's not my goal, is not completely just to be a killer in that. Like, and I know other people feel that way, but like when you get to the point where you're a Fortune 500 company, I understand how that's all you're thinking about is just being a total killer in business and, whatever. But the problem is that's really, really awesome when they're like fighting for you and when they're like fighting pharmaceutical companies and stuff. That's awesome. That's what that power is for. But then as soon as that power is turned around and used against like the individual, like people trying to get drugs that like can't, like, I mean, one of the stories again I was reading when I was doing the research was a lady went in and she needed her insulin raised. The doctor said like, you need to give yourself more units. And she said, yeah, but that's like not economically viable for me. Like I literally cannot afford to do the prescription as you're asking it to me. Like that's insane, right? Like that's not, I don't care how much money you need. You shouldn't be, specking another Lamborghini as the CEO when that's going on, right? Like that's not what your company was founded for in the first place. That's not why you got into medicine. And, that sucks.
Well, they have a couple of horror stories on the internet about people that they couldn't afford the insulin, and so as a result, what they did is they kind of they limited the amount of insulin that they were taking. So instead of taking 10 or 15 units, they take 6 or 7 units. And a couple of these folks, they died. They died. And they so you're living in the most prosperous country in the world, and yet you have people that cannot afford the medications. It's just something's not right. I know that I think that the solution is that people should complain a lot more. People should complain a lot more, and they should contact their Congress people, because what's happening is these Congress people, these are the people that are actually being swayed by these lobbyists, and so the lobbyists. When you go down to the Capitol, these lobbyists, of course, they call them lobbyists because they're in the lobby all the time. That's how they got the name, and they're hanging around. They're like flies on sugar. They're all over the place, and so if you're a congressman, it's almost impossible for you to get into your office without having some kind of an appointment with these guys, or being stopped in the hallways or something. And so I think that is certainly one of the things that you can best do is to contact the people that are in government and tell them that you're not happy with the way things are going.
I think, I mean, if you like, if you can't use the system, like, to the way that it's supposed to be used, like that's exactly what you're supposed to do. You have a problem, you contact your congressman, you have an issue, and you bring it to their attention, because that's their job, to hear their constituents' issues and to try their best to solve them. Like, I think that part of that is the problem with the distrust, a lot of times on the, on other sides of the aisle, or just from people from different perspectives, they have such distrust built up to anything government. And like, I would count myself among that pretty soundly, but like at the same time, like if you have an actual issue, the only thing that's like swaying these people is money and time, and the money's converting into time for people to talk to, that's what the lobbyists are. They're so like, just if you have the time to sit and, be upset about it, if you have the time to be to complain about it online, then complain about it to the right channels. Because if you're complaining in the right channels and nothing happens, then at least you really did try. At least you really did try and have an effect,
Mm-hmm. Yeah, it becomes complicated. It becomes very complicated. And so, because a lot of times you can complain about things, and yet you don't know how these things are being, being how they're being manipulated in the
Right.
background. And so I know that there's with the administration now, I know there's a number of programs that are out there trying to limit the costs of both the pharmaceutical costs and the insurance costs. But I think these are two things that have got to be regulated. They've got to, and without government getting too involved in it, I think that we have to get to the point that we're at least keeping these costs down, because particularly with the matter of the pharmaceutical, it's not just a matter of having your opinion heard. It's, in some respects, it's a matter of life and death. And so,
right.
if you're talking about something that's possibly a life-saving, and you really don't have an equal footing, you don't have the ability to really deal on an equal basis with these companies. I think at that point, I think the government has some obligation to come in and kind of stand up for you. Yeah.
Yeah. I mean, when people ask for the government oversight, or government oversight just in general on any topic, like there's so much common sense, and obviously common sense can't be, codified into law. That's not how it works. But at the same time, like when you're saying you want government oversight to make sure that, like, cost of medicine, doesn't go too high, it's so easily for that to be perverted to be, you want government to go in and, like, make it socialized medicine. You want to do all that. And it's like, no, very simply put, is what you asked is the same thing that a lot of the people ask for, right? It's like people just want there to not be people in the greatest country on earth, like, struggling to get medicine that, like, saves their life. You know what I mean? Like, these are not elective medicines that this is a problem with. This is not, something that, like, is maybe, has debate over whether or not it's helpful. Like, this is, like you said, it's 100 years, which is mind blowing to me, by the way. But 100 years this drug has been out, and we're still having people who need to go up units and can't afford them, or are self-rationing, or you know what I mean? It's just horrible. Like, that is not at all what the American dream is supposed to entail. Like, some of this stuff needs to be common sense. Some of this stuff needs to be solved before people have to cry. But obviously not. That's just not how it works.
I think that we got to make things simpler, less complicated. Sure. And I think that things have become so complicated and so many steps that it's very difficult for the average person to kind of figure out what's going on. I think if we can kind of simplify a lot of things that are going on and make it easier for people to understand, I think that we'd be able to get to the bottom line easier. And I think by the bottom line, what I mean is that the drug costs could be kept in check, and the amount of money that's being wasted or being spent could be kept in check, and that the welfare of the people could be better emphasized than is currently being done. And hopefully we're getting there. But I do think that it's important that people make their needs known to their congressmen, to the representatives, and to do it on a repeated basis. To make these needs known, and to make it sound more urgent, so that they get the message. because I think a lot of times what happens is we're we're getting sidetracked with a lot of things that really don't matter. And I think that rather than getting sidetracked, keep our mind on the ball. And the ball is to keep these prices down, to make sure that people have the medication that they need, and to ensure that in a country such as ours, that we have adequate medical for people in need. Yeah.
And yeah, I mean, it really should just be that black and white, and you'd think that it would be, like in and almost not almost, but in a lot of other realms, like that is kind of what happens. You know what I mean? Like you have a government run postal service, or you have, like I mean, even like I have like government insurance, right? Like that, it's not actually government insurance; it's United Healthcare, but like it's obviously issued through the state, and like it's that if that didn't exist, like then what would someone in my situation do? You'd say like get cheap insurance, whatever. Like there's a million other opportunities they can do, fine, whatever. But it does make it significantly easier and significantly simpler, like you say, when there is a way for me to go out and get insurance that will, like, I mean, like I literally got a dental cleaning today, and it was, it's good. Like it works. The insurance has been fine. I haven't had any issues with it, and like you could do that same thing on a pharmaceutical level. It doesn't have to be like pure, like I don't think that like government insurance is that great, but like it doesn't have to be something so taboo where it's like immediately like socialized healthcare, as soon as someone brings up that they want like price caps, and they want like an end to like just purely like profit based incentive for pharmaceutical companies. Like there's nothing wrong with that. Like you need it. It's a necessary evil or a necessary uncomfortability, no matter what, even if you're a small government person, to have some sort of oversight.
Mm-hmm. Don't you see that there is sort of an interconnection between the insurance companies and with pharmaceutical companies, and one kind of feeds off the other?
100%. I think that the insurance companies are the ultimate like issue. Realistically, I think the pharmaceutical companies have like a lot of problems, but I think the insurance companies, like at least from my perspective, living with the physician and what she like tells me, she has most of her issue with the insurance companies. That's who she thinks causes most of the problems, intervenes in patient care the most. And realistically, that's what we're talking about. Is like whether you just talk about it through the lens of drugs or through the lens of government oversight and pharmaceuticals, we're talking about patient care and how it shouldn't be like patients in America shouldn't want for anything, right? Like we're well beyond the ability to accommodate that, and
well,
I don't think it's that difficult.
I think though that I think that when you're talking about the insurance companies, one of the reasons why they seem to get the people are more upset with them is because they deal with them. So right. In other words, your premium is going up. You have to pay for the insurance. The insurance says they're not going to cover you. The insurance company says they're going to pay you less than you feel as though you're entitled to. So that's who you're dealing with. But the insurance company is dealing with the pharmaceutical company.
That's true.
So you're really not dealing with the pharmaceutical company to the same extent as you're dealing with the insurance company. So you're more aware of what's going on with the insurance company than you are with the pharmaceutical company. You see what I'm saying?
Yeah, I guess that makes sense. It's the same thing as like, if you Google an issue with a product or with a car or something like that, the loudest majority is going to speak. You know what I mean? If you sell 1 million cars, you have 100,000 issues with it, and you have 200,000 issues with the car that they sold 200,000 of. Which one's going to be louder? You know what I mean? Which group is going to be louder? The one that there's more of, the more people are asking the question. So like, I do get that. I guess my problem with insurance companies is that they're the liaison between the pharmaceutical company and the client, but it does feel like a lot more of their time is spent stopping, like limiting client care rather than aggressively going at the pharmaceutical companies and changing the way they do.
Yes, they're the ones that are limiting you, and which is the reason that you don't like them as much.
Right.
But by the same token, when you talk about these people hanging around the lobbies, you probably have as many pharmaceutical people hanging around the lobbies trying to talk to these legislators as you do insurance people.
Sure.
They're around.
Almost certainly, because the money is there too, right? Because the pharmaceutical companies have all that money too.
They do, but a lot of times the money is being paid to them by the insurance company. So when you're being told no, you can't have this, you're usually being told by the insurance company rather than by the pharmaceutical company.
Right.
Although it may very well be that the pharmaceutical company is charging so much that the insurance company is kind of in a bind as to whether or not they're able to pay for it or not.
Right.
So, but I think
as long as they're both private entities too, they can keep a certain level of blindness between us and what that conversation actually is between the insurance company and the pharmaceutical company, right? Like they can make it so that you and I don't know what that looks like. And then like, because we don't know for sure, we can only like surmise, you know what I mean? And then it's like, then then it's how do you really find who like the ultimate villain is? It not that it's a cartoon and there's going to be an ultimate villain, but like this, like, how do you find who's the one who you actually need to like go after and you actually need to legislate when they're both kind of like almost he said, she said, like they're kind of can both point the finger at each other to a degree.
So I think the insurance companies and the pharmaceutical companies are kind of working hand in hand. So there's three people involved. There's three entities: the pharmaceutical company, the insurance company, and us. And of course, the only difference between us is we're paying the pharmaceutical companies, and we're also paying the insurance companies. So we're the payers. Yeah, we're the payers, and they're the beneficiaries of our payments. And that's that. I don't know.
Yeah.
Have we beaten a dead horse already, or how's that going?
I feel like that's a horse that the drugs are probably too expensive to revive. You know what I mean? No,
yeah. Yes. No. I think I think that the good thing about this is that I think people are becoming more aware of it, and I think that's the first step in changing things. People are becoming aware of it. People are aware the insurance costs are much too high. The pharmaceutical costs are much too high. And these people, they're on both sides. They're making too much money, which is fine. I have no problem with people making money, but they're making money to the detriment of to other people. And they're making too much money to the detriment of people that are in very bad shape, either physically, mentally, or a combination of both. And they're in a bad situation, and these two companies are taking advantage of that fact. And as you were saying before, you've got this guy tooling around Alfa Romeo, where you've got some other guy in a hospital bed that necessarily he shouldn't be in, but he's there.
Right.
And so on that note, I think we probably have said as much as we need to say. What do you think?
Yeah, I mean, there's literally constant things to talk about always. You know what I mean? There's always some sort of something going on because we happen to live in a time where I think there's just more information than there ever has been, right? Because the internet and like the amount of I mean, the internet's like, or not internet, sorry, information's like force fed to you. It's like, like you can't open your phone without being force fed information. I can't open another tab on my browser without having a news thing pop up and, tell me something, right? Like it's constant. So there's always, a horse to beat, so to speak. But I think that if you want to go based off merit, like talking about keeping insurance prices affordable to make sure that people are, not dying because of money, I think that's a pretty solid horse to beat. You know what I mean?
Yeah. And besides that, if there's something to moan and groan about, I think both of us could do that pretty well, don't you think?
I can groan about anything.
Yeah. What the hell? I mean, you give me something to complain about. I can work on that pretty good.
Oh yeah. I mean, everything's out of whack right now. You know what I mean?
Yes.
You walk out of your house, it costs $50. Period.
Yeah. Yeah. Actually, you stay in your house, probably going to cost $75. So that's,
right.
So that's the old damned if you do, damned if you don't. You see.
Absolutely.
Yeah.
Absolutely.
On this level, I want to leave you with this. I want to leave you with this upbeat note, sir. Screwed if you do, and screwed if you don't. Okay.
Yeah. Absolutely.
All right. There you go, sir. Keep a smile on your face and use it as an umbrella, and don't get a mouthful of rain. Okay.
Will do.
Peace.
Peace.